Hi, this is Allison Villars, Director of Health and Human Services here in St. Tammany Parish, and I'm here today to welcome Barbara Strain. Hi, Barbara.
Hi, Allison. How are you?
And Barbara is the Director Manager of the Federal Qualified Health Center, which she's going to tell us all about in just a minute. But that center is located at the Wellness Center, which is on North Florida. And it's a brick building, and it's the half of the building where the Women, Infants, and Children's program has been. And now the WIC program is still there, but we've added two things, behavioral health and primary care. So Barbara's managing all this. It'll be very exciting to hear where they are right now. I know they're open if you need to go. Hey, Barbara.
Hi, thanks for having me.
We're really glad to have you. So the first thing we want to do is find out about you. So how did you get to work with a Federal Qualified Health Center?
Well, I am a licensed counselor, and I have been licensed for coming up on 30 years. So I have lived in St. Tammany Parish for 26 years. So I worked at a facility here in Covington for the last 11 years and was under the direction of Trudy Franks, who works with the START Corporation. She is the director of the FQHCs under the START Corporation. And because she had been my supervisor, and I worked with her for 11 years, she wanted me to have an opportunity to be director of this wonderful clinic as well. So, and by history, START Corporation is, the CEO is an LCSW. So,
and that's Casey Guidry, right?
That's Casey Guidry, yes.
Okay.
Yes. And START Corporation has been around since 1984. Mm-hmm. So, and their heart is to provide community services that help folks who are the most vulnerable and who may not have the income to help themselves with medical care or mental health services. And they've been able to do a good job of that throughout the state, mm-hmm. Providing different services.
Right.
And so they connected with St. Tammany Parish Hospital to work in partnership with them for the WIC program, which we started running September the 4th.
Right, so you guys, hold on just one second, let me sort of catch up here. So I know that the hospital, and when it was under Patty Ellish, and now with the new CEO, and Carrie Milton, the head of nursing, yes, has really been spearheading this on the grounds thing, putting the contracts together, et cetera. So I just want everybody to understand that the St. Tammany Parish Hospital did its due diligence, and they interviewed 4 Federal Qualified Health Center possibilities. Yes. And of those 4, they chose START Corporation because of many things, but the stellar reputation is among them. And they met Trudy and Casey, mm-hmm. the FQHC director in Trudy, and then Casey as the executive director. And they understood from them all the possibilities that could be created on the west part of St. Tammany Parish. So I wanted people just to know that it was a competitive process, and they're the group who actually came into being. So we're very happy to have you. Do you know your physical address offhand?
It's 1505 North Florida Street in Covington. It's near the fairgrounds and Lyon Elementary School.
Okay, so that's the physical location.
Yes.
So you took over WIC first, which is Women, Infants, and Children's
yes.
programs, and you have staff who have been doing that for a while.
Yes.
Continuing to do that, correct?
Yes, for about 14 years.
Okay.
And they service probably around 1,500 participants a month. Mm-hmm. Yes, so from the parish, St. Tammany Parish. There is a program in Slidell, but I think a lot of folks come to the Covington office mm-hmm. for assistance. So it's a big program.
It is a big program. So what does Women, Infants, and Children do?
They provide supplemental services such as formula for mothers and for their children, newborn, postpartum. Right after a mother has a baby, they can access the WIC program for formula. They do breastfeeding instruction. They have classes twice a week for breastfeeding. They also promote nutritional foods and provide nutritional foods. So it's really a supplemental program. It's not necessarily the formula for families, but they are to assist in helping provide that. That formula that's needed for children. And so there are guidelines as to the folks who can receive those services below the poverty level. And so when you call to make an appointment at WIC, they will go through with you to see if you meet the income guidelines to be able to assess their services. They also give free breast pumps to people who may need those as well. So there's a lot of education to mothers and their children, and they can see the children up to age 5 years old.
And when you say they can see the children, what does that mean?
Well, they assess them to see how they're nutritionally, how they're coming along, and if they're needing any assistance as far as education, that type of thing, and make sure they measure them and they weigh them and all of that, and they make sure that they're growing well, and they partnership with their physicians and make sure that they're that they're just progressing the way that they should nutritionally for their age and developmental stage.
Okay.
So.
And 1,500 participants, does that include mother and baby, or does that include?
Well, it kind of, from what my understanding, because WIC is very new to me, is that it depends on the vouchers that they receive, and so the vouchers would be what they obtain to be able to get the formula that they need. So, their breakdown may be more intricate than I am aware of, the data, but according to Robin Birdsong, who is the WIC director in our office, at present, without looking at the statistics, that they're servicing at least 1,500 in combination of mother and children. So.
And Robin's a nurse, correct?
Robin is an RN.
RN,
and she's been a long-term nurse working for St. Tammany Hospital and the WIC program, and she knows the program well, and does a great job of providing that service.
Well, you have another service that you and I are going to talk about, and that's behavioral health.
Okay.
So tell me about the behavioral health services you have available.
Okay. What we have presently is we have a nurse practitioner, Haley Miller, who works under the direction of Dr. Kim, Hyan Kim, who is a psychiatrist. He's her collaborative physician. And she's with us on Tuesdays, and so she's able to provide medication management for folks who are needing psychiatric medications. And guidance as far as medication is concerned. And so in conjunction with Haley, we also have Amanda Blair, who is an LCSW. She's a licensed social worker, and she sees folks individually Monday through Friday, 5 days a week for counseling. And she can see children, both Amanda and Haley can see children to senior adults if they need that service for mental health services. Amanda's worked a lot with adolescents, and so she has a great deal of experience in working with children and adolescents and adults. So,
So are we talking about just mental health, or are we also talking about substance use disorders?
We can follow folks with substance abuse disorder. We will assist them with, counseling related to getting away from that addiction or treatment for that addiction. And if they need further assistance, like they might need detox or something like that, what we would have to do is refer them to a local facility that could provide detox, and then we could follow them afterwards. So Haley is able to prescribe medications related to that. We are working towards the providing medically assisted treatment for those with substance abuse, with opiate addiction. Suboxone treatment is being done in the HOMA FQHC at this present moment, and we're planning to be able to do that as well.
That's great.
Yes, yes.
I don't know much about it, but I know it can help people move off of opioids.
Yes.
And go on to something that's okay or medically supervised.
Correct.
And they get those drugs on a periodic basis in order to maintain some level of ability to then go and live their lives.
Yes, so Suboxone is an opiate as well, but it's a better managed opiate. Instead of going out on the streets and getting whatever you might need, or an opiate, a person who's addicted to opiates might get for themselves, it would be medically assisted and monitored and given the right amount of dosage so folks can maintain. Mm-hmm. And a lot of folks who are seeking out Suboxone are professional people mm-hmm. who want to continue to work and be managed and not to abuse the substance.
Right.
So, and that's kind of what we're hoping for health reasons, and for, so that they don't overdose mm-hmm. on an opiate, and which is happening a lot.
Mm-hmm. So can you give us your phone number? Like if I was interested in going to see a behavioral health person at your site, or interested in women, infants, and children, what number do I call?
You would call 985-900-1626.
Okay, so we'll put that on the screen for everybody to see.
Okay.
And is there a website where we can check out what you do?
Well, the START Corporation does have a website, and you can just Google START Corporation in HOMA, and it will tell you all the various services that START does provide throughout the state. And they are in the midst of putting the Covington site on the website as well.
And START Corporation is a nonprofit.
It is a nonprofit. It is. It's federally qualified, and so we are able to service the most needy. We service folks with primarily Medicaid, Medicare, and those who just don't have the income. We will work with a sliding scale fee for those folks so that they can come to our clinic.
Okay.
And a lot of people out there who don't have health care. What we also can do is, if we find that folks who are on the poverty level and do not have insurance, we will assist them in applying for Medicaid, so that they will be able to hopefully get some type of medical assistance.
Sounds great.
Yes.
Well, Barbara, we're going to talk to a colleague of yours shortly about primary care, and we're really pleased that you could come and visit with us today. Thank you very much.
Thank you for having us.
Okay, so this is In the Loop, a first part on the Federal Qualified Health Center that's located in Covington. We also have one in Slidell, so just remember that there's one on Robert Road there. But this is the brand new one that's opened up in the west part of the parish. So if you need assistance in Slidell, that Federal Qualified Health Center is also available to you.
Research indicates that today's children may not live as long as their parents. That's why the American Heart Association created this new comprehensive health, wellness, and fitness movement, My Heart, My Life, to empower Americans to get healthier. As part of this movement, The American Heart Association is launching innovative programs in communities across the country. Focus on eating and cooking healthier meals, getting daily exercise, and learning how to grow nutritious foods. We bring communities together with the common goal of improving health through fun and engaging activities like community kitchens,
My heart, my life, my community.
teaching gardens,
My heart, my life, my garden.
walking paths, and family fitness activities.
My heart, my life, my path.
With over 99% of Americans needing to improve their heart health, we want to encourage all children, adults, and families to get active together.
My heart, my life, my family.
Join the movement, myheartmylife.org.
Hi, this is Allison Villars, Director of Health and Human Services at St. Tammany Parish. We're back to In the Loop, and we're still talking about the Federal Qualified Health Center that's just opened recently on the west side of St. Tammany Parish on North Florida Avenue, in the brick building that has the Parenting Center on one side and Women, Infants, and Children and the Federal Qualified Health Center on the other. And now I have Dr. Jennifer Creech, who is going to tell you a little bit about her background, because I can't say all the initials that she has behind her name. Okay, so Jennifer, glad to have you.
Thank you. Thank you for having me. So I am Dr. Jennifer Creech. I am a family nurse practitioner. I am an advanced practice registered nurse with my doctorate in nursing practice.
That's a whole lot of things. So wait, you can, as a doctorate in nursing practice, what did you do?
So I did something very similar to a dissertation. However, it was called a doctoral scholarly project, which was actually done at an FQHC in Orleans Parish.
Okay.
So it was a 3-year program. It ran concurrently with my nurse practitioner education. So I was working on 2 separate things simultaneously. And just to backtrack just a moment, next month, I'm going into celebrating 24 years in the nursing profession. I graduated in 2016 at Loyola University, New Orleans. And at the time, they had a very unique program where you can actually get your, go from your Bachelor of Science in Nursing as a registered nurse. So you go from your Bachelor of Science in Nursing and you skip over all the way to the doctorate level. Oh. So I did not have a master's degree. So kind of like an expedited track due to the critical shortage of primary care providers as well as faculty to teach graduate level nurses.
Well, we're really excited that you're here. And I was just talking to Jennifer before we got on the air about all of the things that she's wearing that give her that official look. So an advanced practice registered nurse can do what?
So we're trained to do procedures, minor procedures, things like joint injections, suturing, removal of ingrown toenails, I'm trying to think, a lot of services that you may need to go to urgent care for, or the emergency room. Right. So we're, in addition to being trained on these procedures, we're also in-depthly educated on advanced disease process. So we manage chronic disease such as diabetes, high blood pressure, thyroid disease. So we're able to manage patients to a certain degree. Now, if there are any complications, we certainly refer a patient to either a physician or a nurse practitioner that is specialized in that particular area.
Okay, so and you can see who?
So as a family nurse practitioner, I can see from 1 week newborn assessment all the way to the frail elderly.
Okay.
So at this current time, we are seeing only, or I am only seeing 13 years and older with an adult, with a guardian.
And you will be able to see those 1 week olds
Exactly.
in the very near future.
Yes.
Okay, well, we're real excited about you being here and being accessible to us. So you can prescribe medications, is that right?
Absolutely. And with the opioid crisis and the legislation that has been passed, all providers have the restriction of according to our state law. So we have to keep very abreast of current legislation and law, as well as our own facilities policy and procedure. So I can prescribe a variety of medications, and not just medication, but it is all about lifestyle change. Those non-pharmacological measures, meaning watch your diet, watch your exercise, things like that. And I wanted to mention, not only am I trained to take care of individuals when they're ill, the goal is to be proactive, and that's a big component of primary health care. Being able to intervene at a very early age and help a patient, not just a patient. A patient is an individual, it's a family, it's a community, it's our world. Move patients along, help them maintain the highest level of wellness possible. So we do wear a lot of variety, different hats. So but we want to make sure that we are making sure everybody receives their vaccines and their immunizations, and make sure that females get their cervical cancer screening, their mammograms, DEXA scans, as well as colonoscopies for those individuals that are 50 years and older, according to the recommended guidelines. Everything is evidence-based practice. So, and let's see if there was anything
So
else.
I wanted to know, I just have so many questions for you. I mean, it's a lot. So can you sort of pick a patient without telling us their name or any identifying information about them, and sort of tell us the relationship you established with this person over time and how it worked out for you and for them?
So I connect with every patient, and I empower my patient to be an active participant in their health care. So I just sit down with them. Healthcare has changed from where we were. We have evolved over the last 20 years at least, where it's no longer exactly this is what you need to do, and if you don't do it, I'm going to punish you. And it's all about entering a relationship and mutual respect, and coming to a common ground when it is possible. Sometimes I just have to tell them, your diabetes is out of control. We need to really look at your medications. We're going to need to start something now, and this is non-negotiable. But let's maybe negotiate in a different area when possible. So that's all my patients. Not one particular one.
So how is it that you learn to establish relationships and get those people to take ownership of their own health? Because I know health has been something that was left to doctors for a long time, and if they didn't tell it to me, I don't have to worry about it. So how do you do that with
So it is, it's a personal philosophy for me, and having the doctorate is, it goes into more theory. I practice according to some of the great grand nursing theorists, such as Dr. Jean Watson, who is still alive. She's in Colorado. She developed the theory on caring and therapeutic touch. And I also am a big fan of Dr. Madeline Leininger. She was responsible for creating the grand theory on transcultural nursing. She recently departed us here when she was roughly 93 years old, and it wasn't that long ago. But as a doctorate, it is my responsibility to help effect change on a legislative level. So while I was at Loyola University, I became president of, first of all, my cohort, which was my class. So I was the class president. As the class president, I was the liaison between the student body and the faculty, and I became very active in my nursing profession, and it just empowered me. I became president of the Louisiana chapter of the Transcultural Nursing Society. That's a mouthful. And I put on my first nursing symposium. It was a tri-state symposium, Louisiana, Mississippi, Alabama, under the amazing guidance of Dr. Jenny Gunn, who created, she's on the international board of the Transcultural Nursing Society, and she empowered me to she saw my potential and she guided me. And so not only are my mentors grand nursing theorists, but they're everyday people, but they're very well respected in their roles as advanced practice registered nurses. She's a nurse practitioner.
Right. Well, you could pretty much write your ticket anywhere, so why a Federal Qualified Health Center here in St. Tammany Parish West?
So that's a good question. I have been guided here. It was, I don't want to say I want to say a miracle, but my doctoral project that I did in New Orleans at the FQHC was a quality improvement initiative. And essentially, I conducted a mock Joint Commission survey so that this clinic could realize where they stood if they wanted to become a Joint Commission accredited medical home. I'm a huge advocate for the medical home concept, which START Corporation, not only is it an FQHC, it's also a certified medical home. So I've always been drawn to the FQHC because it's caring for patients not only that are underserved, but it's everyone. And so I recently came from an FQHC in Bogalusa, Louisiana, and I just needed an opportunity to be able to practice at my fullest capability, the top of my license and the top of my educational degree. And that is this is why I am at START Corporation. I am given all of the support that I need from Trudy Franks and Barbara Strain. They have been incredible. So, and moving forward, you said I could write my ticket. I have other ideas as the doctorate. I wish to design 2 community programs. So that's where the doctorate comes in. I've been educated on how to design, implement, assess community programs, and one of the programs I'd like to do is with the Mardi Gras Indians, and a second one is with the Vietnamese and Latino population in New Orleans East.
Well, look, Dr. Creech, we could go on and on, but our time is up, unfortunately.
Thank you.
I think you guys should go to the Federal Qualified Health Center located on North Florida Avenue in Covington, Louisiana, and meet Dr. Jennifer Creech. You can hear a whole lot more from her, and she's going to help you take care of your health and empower you to do so long term. So this has been In the Loop with Allison Villars and St. Tammany Parish.